radiofrequency ablation is a technique we use to intercept the painful signals coming from painful joints in the low back. To see if a patient is a good candidate for this procedure, we do a test run, which is a diagnostic injection where we use a little bit of lidocaine and put it right where that painful nerve is and numb it up. So if numbing up that nerve helps their back pain, that's our confirmation that the patient does have pain coming from small joints in their back, and targeting those painful nerves can help their pain. We actually have to repeat that procedure once more just to confirm the confirmation, and then if that's the case, we bring the patient back, put the needles in the exact same place. Patient is made comfortable during the procedure, and then we heat up the tip slightly and just enough where we intercept that painful signal, and that procedure lasts months and months and months. Our goal is to make sure it lasts at least 6 months for them. Quite often it lasts 9 months to a year or even more. When we're talking about pain in small joints in the back, we refer to it sometimes as axial back pain. It's a fancy way of calling arthritis the culprit. So arthritis can happen in between any joints in the body. People commonly refer to the arthritis in the knees, the hips. They can also happen in the small joints in the back. We have a lot of small joints in the back, so all those can cause pain. But patients not only feel pain because there's something going on in the joints in their back, it's also because of the nerves in the vicinity of those joints pick up the painful signal, carry them to bigger nerves, and ultimately out to the brain where we perceive the pain. So what we do is we try to intercept those painful signals as they're originating in their low back to prevent the patient from appreciating that pain. Nerves do grow back, but it takes months and months for them to grow back. So that's where the repeating of the procedure 6 months or longer is advantageous, because it takes that long for the nerve to grow back.